Did you know that over 60 million women in the US are currently living with some form of heart disease? Did you know that it is a current leading cause of death for women in the US, and that 1 in 5 women are not aware of the severity of heart disease in their health? Heart symptoms for women are varied. Traditionally, it has been taught that if there is pain in the neck, in the jaw, in the upper back, or some discomfort radiating to the left arm, yes, those are classic signs of heart disease or heart attack, but that's not the only sign. In women, it may present as shortness of breath. It may present as pain in one or both arms. You may have nausea, you may have vomiting, you may have lightheadedness or dizziness, unusual fatigue, indigestion. In women, it seems like the indigestion is the GI symptoms tend to be more common. And so this is where, as individual beings, we're going to have to kind of check ourselves and kind of go, okay, if we're having these symptoms, is this something that a Tums will take care of? And if you take a Tums, do you feel better? If you're prone to GI issues, is this something that's more consistent with your pre-existing disease? Or is this something that feels different and comes with a sense of unease? There are those of us who are prone to anxiety and depression, and we tend to kind of focus a little bit on every little symptom. This is where you're going to have a serious conversation with your inner anxious self to ask if this is something that's born out of an anxiety that triggered it, or is this real? If you're not sure, please err on the side of caution. Go to the urgent care office or your primary care if you can get an appointment right away. We have risk factors: excessive weight, smoking, stress, depression, unhealthy diet. Now, let me just speak a little bit on the excessive weight. Adipose tissue doesn't have enough blood vessels. And so if there's excessive adipose tissue, that heart has to work hard to keep those adipose tissues healthy and not dying and smelly. So if the heart is not healthy, excessive weight can increase your risk of having a heart attack. So this is Dr. Heather Stanley, just dropping this tip. Know yourself, know your symptoms. If you're not sure, find a doctor. If you're really concerned, find an urgent care. And I want you to take good care of yourselves. Have a great day, and I'll talk to you tomorrow.